For the straight catheter, I'm going to peel it open. If I can find the edge. There we go. Take a look here. So I see where it's folded there underneath, so that's where I need that side. That's where I'm gonna be having it fold away from me eventually, but right now I can just take it out and see how that fold is going. So I need to let it unfold is fine, and that's the fold that I want to be going away from me first. So positioning that so that my hand will be able to fold it away from me. I'm gonna get my trash out of the way here so I can fold away, and being very deliberate of where I'm holding here because I don't want to contaminate on the middle. And grab just the corner here. And then lastly, pulling toward me and kind of straightening out. Oop, see this side almost curled back in on itself. We were saved though. Now I can take I can see the shiny side. That's going to be facing down to the bed. So I wanna, if I'm gonna touch anything, grabbing that shiny is okay. And also anywhere along the 1-inch border is okay. So I'm going to very deliberately unfold my drape. And place it shiny side down. Get my trash out of the way here. And if the patient is able to assist, can lift up their hips while I pull this underneath their buttocks. So I have my gloves are now accessible, so I want to pick them up without contaminating anything else on my sterile field. And I can move all of this to the side. I'm being careful to only touch on the border. And I can move my table if I need to. Have a little more space, or I could do this gloving on the patient's bed would be acceptable as well. Okay, I'm not letting it fold back in on itself. I'm going to glove my dominant hand first, and I see there's one finger that's kind of touching over the cuff, so I want to be really aware of that and make sure that I'm not getting near that finger. I want to line up, get my hand in. Now that finger went away, so I want to find the thumb hole especially. There we go. So that's gloved. Put my hand under the cuff here. Once my hand is up, I want to make sure to hyperextend my thumb so that I don't contaminate against the cuff. And now I can fix my fingers and interlock to designate I am sterile. So I can move things by touching only sterile to sterile, keeping an eye on everything that I need to. Now I can touch the sterile contents in here. I have a fenestrated drape personally for females. I don't like to use them, so I'm just gonna toss it to the side, making sure that as I'm dropping it, I'm not touching my sterile gloves on anything they shouldn't touch. I can prepare my iodine. And this is your final pause of, did I verify allergies before I'm doing any of this stuff? So I'm going to simulate preparing, and that is now fresh. Can toss on the side, making sure not to turn my back on my sterile field. My forceps can stay in there. I have a lubrication packet in here. Some people like to squirt the jelly out. Other people like to kind of dip the catheter in. Either way is fine. I want to loosen up this lid or even have it ready to go so that when I'm ready to collect my specimen, I can do that pretty easily. Okay, so now I'm ready to, oh, and I also want to check my connection here, that I have my straight catheter is connected onto the bag. Not every manufacturer comes like this, but some just have you drain right into a tray. And this one has a bag though, so I just want to make sure that that connection is secure before I insert the catheter. And I can go ahead and get the lubrication on the catheter. 1 to 2 inches for a female, 5 to 7 inches for a male. Okay. If I have any extra lubrication, I can just drop it in my trash area. Right, now I'm ready to transfer this tray. And as I drop it, I'm within the borders, so I'm still in a sterile field right now. I'm ready to dedicate my hand, keeping the labia open, cleansing the labial fold away from me, out, over, put in my trash, labial fold nearest to me, into my trash, and from clitoris to anus right down the middle over the urethral meatus, and drop my forceps in my trash area. And now I will get rid of my extra cotton balls too, just get them out of the way. If I didn't need to collect a specimen, I could have also gotten rid of that specimen cup as well. So with a straight catheter, I'm just going to hold a few inches from the distal tip, instruct my patient to bear down as if to void, and go straight in. Continue inserting until I see urine, and then 1 to 2 inches further. Now I can hold it in place with my non-dominant hand while I release the bag if it comes with a bag. If it didn't come with a bag, I would be making sure that the tip of the the open end of the tubing stays over the collection tray. Okay, I'm going to allow the bladder to empty entirely. If I don't see any urine, just troubleshooting, make sure your clamp is open as well. Once I have touched on my tubing here, I never want to continue inserting because this is now considered contaminated, so it's not sterile anymore. Sometimes it's helpful to apply, this is off the textbook, just a personal tip of mine, is to apply a little bit of pressure on the area above the bladder to help facilitate drainage. Once it seems that urine flow has stopped, we're going to remove it little by little to continue to allowing urine to drain. And eventually, when all the urine has stopped, we're going to go ahead and remove the catheter. And we can clamp so that no urine comes draining back out. If we needed to collect a sterile specimen, whoops, and that's exactly why we clamp it, we could do so by tearing open the tab or leaving this open and pouring some into the specimen container, like so. And as you're collecting a specimen, your hands have been contaminated, so you want to be careful to only touch the outside of the specimen cup. Okay. and then cleanup and documentation.